Hello, my name is John Tahito. I'm the lead for the Research and Academics Committee, and I'd like to provide an update for this year thus far between January and July of 2024. And so I'll just go through some of the things we've done thus far. So in January, I sent out this manuscript that our group has completed. This is a retrospective analysis of dialysis patients presenting to the emergency department with bleeding AV fistulas or grafts, essentially looking at what factors are associated with requiring a procedure to resolve the bleeding or a fistula or graft. Dr. Fine became involved and is now a listed author as he reviewed the manuscript for us and is currently under consideration by Acute Medicine Journal. We also put together a case report in January and reviewed by the committee in February. This patient was seen in the Franklin Emergency Department and diagnosed with pituitary apoplexy, SIADH, and adrenal insufficiency due to a pituitary mass, and was successfully treated after transfer to our neurosurgery and ENT colleagues at Columbia St. Mary's. And so we wrote up this case report, and it is also under consideration by the Acute Medicine Journal. Rebecca Hassler, Matthew Treat, and Dr. David Fine are all involved in this manuscript as well. We've also started a research project on which looks at tranexamic acid. So even though tranexamic acid has been studied quite a bit, research on tranexamic acid, or TXA, has resurfaced over the past 2 years. It's essentially being kind of reevaluated in the medical literature. In February, we developed a protocol looking at tranexamic acid treatment for angioedema. Jeff, the pharmacist at St. Joe's, as well as Matthew Treat, and then a medical student at MCW named Austin, are all involved in this study and on the IRB protocol. We have the methods all put together, and the chart review is actually currently in process. We have over 500 encounters that we're going through. Janine, the pharmacist at Columbia St. Mary's, asked our committee to evaluate a data set that her and her resident have. Trent Kapla is also working with them on this data set because they're looking at appropriate and inappropriate treatment of suspected UTI based on culture results. And so she asked me and the committee to go through the data set that they have to see if any statistical analysis and potentially statistically significant results can be obtained from it. And so that was offered to the group. Matthew Treat had involvement in this as well, and so we were happy to help out Janine. And overall, with Janine's request, and then having Jeff involved in the TXA study, it's nice to have some kind of multidisciplinary involvement in the committee. In April, I was asked by the Journal of the American College of Emergency Physicians Open to review a manuscript that they are considering called Diagnosing Aortic Dissection, a review of this elusive and lethal diagnosis. So we reviewed this and submitted it back to the journal, and Matthew Treat and Heidi Toth were involved in this critical review of this manuscript. We then reviewed another manuscript. The Visual Journal of Emergency Medicine asked us to review a cardiac tamponade in a young man presenting with syncope, a case report that they had, and so Dr. David Fine helped me review that manuscript. And then we also received a case report from Dr. Andy Konachek. He had a good case of gallstone ileus in which the patient was surgically managed and then returned with a repeat visit related to choledocholithiasis. And so once all of the radiology functionality is back up after the downtime, we will be able to, the entire manuscript except some of the images are all that's pending. We've written the entire manuscript and we'll be able to start submitting this case report to journals pretty soon. Dr. Brady McIntosh proposed an interesting research question looking at emergency department workload and medical errors. And so I've actually put together a protocol that we'll be submitting to the Ascension IRB and reached out to our peer review committees. Dr. McIntosh and I will be offering this as an opportunity for the entire group as well. To look at errors as determined by the peer review committees. Peer review committees have agreed to provide me with encounters that were determined to be errors in the emergency department, and we're going to look at certain physician and provider level characteristics related to these errors to see if we can find any associations. So this will be sent to the Ascension IRBs soon. It's almost completely ready. And then we had another case report in the Visual Journal of Emergency Medicine that they asked us to review. So this was offered to the committee. We reviewed this as well. It's a fat embolism syndrome in a 13-year-old male with Duchenne's muscular dystrophy who presented with altered mental status. Some future project ideas that I asked the group about, and I received some input. Dr. David Fine has an interesting case of reversible cerebral vasoconstriction syndrome that we likely will be writing a case report during the second half of this year. And then Andrew Mikowski asked us to consider putting together a research study looking at some factors in clinical medicine that we encountered during the cyber attack, specifically culture callbacks, and see if there's some clinical or research question that I can come up with to evaluate this particular challenge that we came up with in order to help other healthcare industries and healthcare systems when they may involve a similar event just like we did. And so overall, thank you very much. If you have any questions, feel free to email me, and hopefully this provides you with a good overview of the progress that the committee has made during this year. Thank you.